This is the case study on hemophilia. Causes. This is a rare disorder in which blood does not clot properly. This is because of a genetic disorder that is inherited on the X chromosome, so it's X-linked recessive, making this more common in males, though females can get it, just not at such a high rate. There are two types, type A and type B. Type A is the most common, and this is type A is insufficient or missing clotting factor 8, and type B is missing clotting factor 9. When someone is missing their clotting factor, they cannot create strong platelet plugs, which is what helps stop bleeding, so this is why they bleed longer. Tests during pregnancy. If you have a family history of hemophilia, you can check to make sure your baby has it or not. And at birth, the umbilical cord would, once it's cut, would excessively bleed. And obviously, you can just take a blood sample and check for clotting factor 8 and 9. And most people are usually diagnosed by the age of 2. People with hemophilia would have signs and symptoms of longer bleeding time, spontaneous bleeding, bruises, swollen, painful joints. This is because blood is actually filling up the joint cavities. There will also be blood in urine and stool, and frequent nosebleeds. Treatment. Now, there are no actual cure for hemophilia, so the people will be living with it their entire lives, but we have developed medication that would help make it easier, such as injection of hormone desmopressin. This stimulates the release of more clotting factor, or you can get a clotting factor infusion. This also comes in the nasal medication form. As for the joint pain, physical therapy can help.